Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Developmental theorists often assert that dysfunction of some sort during growth and development may result in psychopathological traits in adulthood. According to Erikson's developmental theory, which of the following maladaptive developmental conflicts increases the risk of obsessive-compulsive disorder in adulthood? A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. And D. Industry versus inferiority. And so this really is a theoretical question. This is about theoretical foundations of assessment. So from the domains of assessment, diagnosis, plan, implement, and evaluate, this would be an assessment question because you are looking into the patient's background to evaluate risk factors for the symptoms that are in front of you. But even further, this is about having an appreciation for developmental theory. And I can promise you that on your certification exam, you will need to have a basic appreciation for developmental theory. Now, again, you are not studying to be a theorist, and you're not expected to know all the fine-tuning ins and outs of developmental theory, but you are expected to know the basics because remember, this is an examination for certification in psychiatric mental health across the lifespan. So you are accountable to the lifespan. And while it has not been my experience that there's a lot of assessment on those mental health conditions that are very specific to like infancy and early childhood. I mean, there are some interesting and really unique disorders that are seen in the first year of life or the first couple of years of life. It's not so much that that's what's reflected on your exam, but you are expected to have a basic understanding of developmental theory and how it can influence the develop of mental health symptoms later in the lifespan. And so a question like this is a very typical sort of board question, and it provides the opportunity to review Erikson's developmental theory. So the answer to this question is B. B is the correct answer. Autonomy versus shame and doubt is the stage of the toddler, according to Erikson, between the ages of 1 and 3 years. And remember, this is the time in which the child first becomes ambulatory and begins to explore the world around him or her without being solely dependent on the caregiver figure to move from point A to point B. The average age of walking is 1 year. And I know that there are kids that walk earlier and there are kids that walk later, but the average age in which a child can walk without assistance is 1 year. So the age of 1 begins that exploratory phase where they can move from point A to point B without having to have a parent or a caregiver take them. Prior to the age of 1, yes, I know they can crawl for a little bit, but generally speaking, before the age of 1, they need somebody to take them any significant distance. Once they're 1 year old, they can walk on average. So between the ages of 1 and 3, they are ambulatory and they start to explore the world around them. And through the course of these years, age 1 to 3, they also develop mobility and fine motor skills. And so when you combine walking and enhanced fine motor skills, the child will often get into things and get into places that can be distressing to the parent, even unsafe for the child. And the caregiver is responsible for ensuring a safe environment that supports this newfound independence. I mean, the Eriksonian stage is autonomy versus shame and doubt. The child has reached this conflict stage, autonomy versus shame and doubt. They are just beginning to be autonomous. Will that be encouraged so they can learn and explore? Or are they shamed by the caregiver and made to doubt themselves? That's the conflict. And so, according to Erikson, all of life is a series of developmental conflicts. And if we resolve them in a healthy way, then we develop positive personality traits. And if they are resolved in a negative way, then the person has the potential for maladaptive or pathologic personality traits or outcomes later in life. And according to Erikson, the child in the autonomy versus shame and doubt stage who is not encouraged to safe autonomy, but is rather shamed for their independence and made to doubt their independence, this may predispose them to obsessive-compulsive disorder later on in childhood or even in adulthood. Well, every developmental stage has the potential for negative outcomes if the conflict isn't resolved in a healthy way. This is the stage linked to OCD, autonomy versus shame and doubt. Conversely, trust versus mistrust. This is the stage of infancy, the first year of life. Trust versus mistrust is more often linked to depression, substance use disorder, or even psychosis later in the lifespan. Initiative versus guilt. This is the stage of the preschooler, age 3 to 6. And maladaptive resolution of conflict between initiative versus guilt is more often associated with conversion disorder, phobias, somatic disorders like, psychosomatic back pain, abdominal pain, and headache later in the lifespan. And industry versus inferiority. This is the conflict of the school-age child. And when this isn't resolved in a healthy way, it's most consistent with creative inhibition and inertia later in life. So every stage has a conflict, and every stage in which the conflict is not resolved in a healthy way, there is the potential for mental health consequences later in life. But specifically, autonomy versus shame and doubt is the stage in which maladaptive conflict resolution is linked to OCD later in childhood or adulthood.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.